be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.
Welcome to Let's Get Personal, the podcast where we dive into the real-life experiences of living with rheumatoid arthritis, or RA, and get expert insights to help us better understand our health. I'm Shelley Fritz, and today we're tackling a topic that confused me when I was first diagnosed, and probably many of you: rheumatoid factor, or RF. What does it mean when your RF is positive, or when your doctor says you are RF positive? Does RF factor have to only do with RA, or is it linked to other autoimmune conditions too? If it's negative, does that mean you don't have RA? And if your RF is high and continues to climb, does that mean your RA is getting worse? To help us sort through all of this, I'm joined today by Dr. Ted Mikuls, a rheumatologist at the University of Nebraska Medical Center and VA Nebraska-Western Iowa healthcare system, who works closely with patients like us every day. Welcome, Dr. Mikuls. Thank you for joining us on the podcast.
Thank you. It's great to be here today.
I'm so excited to talk with you today about rheumatoid arthritis. Let's get started with the basics. I remember my doctor ordering an RF test early on, and I thought it was going to give me a simple yes or no about RA, but it turns out it's more complicated than that. Can you explain what rheumatoid factor is and why it's important?
Yeah, so it's definitely not a yes or no answer. I can say that up front. Rheumatoid factor is an interesting test. It's one of the oldest blood tests we've really used in rheumatology. It was the first autoantibody that was described in many of our conditions. And it is an antibody. When we think of antibodies as proteins that our immune cells make, that generally fight or target foreign particles in our body. And we typically are thinking about infectious particles there. So antibodies play a role in protecting us from infections. And autoantibodies, as it turns out, like rheumatoid factor, actually, instead of binding foreign particles, bind our own tissue or bind our own cells.
Thank you for that patient-friendly explanation. I was diagnosed 12 years ago, and I'm still learning more about rheumatoid factor. Can RF levels fluctuate over time, and what factors might influence these changes?
Yeah, rheumatoid factor is not specific for rheumatoid arthritis. And I think that goes back to your first comment about it being a yes-no question. It's much more complicated than that. So levels of rheumatoid factor are definitely increased, on average, increased in patients with rheumatoid arthritis. And we see those positive probably in about 70 to 80% of rheumatoid arthritis patients, but that leaves a whole group of our patients who don't test positive for rheumatoid factor. There are many things, as I suggested, in addition to rheumatoid arthritis that can impact rheumatoid factor levels, things like infections or the receipt of immunizations or anything else that might stimulate our immune system can stimulate the production of rheumatoid factor.
Oh, wow. So that's making me wonder something. When a patient is feeling a flare coming on, could it be that that's coinciding with an increase in rheumatoid factor if they are RF positive?
Yeah, that's a really interesting question. It gets to the variability in rheumatoid factor over time. And there is some variability, but I don't know that it's a good enough test that in an individual I could use it to predict the future, that I could use it to predict an imminent flare. And honestly, rheumatoid factor is a most helpful test in my clinic when I'm meeting a patient for the first time. And I often don't recheck it over time in a serial fashion because honestly, it really doesn't offer that much more information. Once I know the status of a patient with their arthritis, whether they're negative or positive, there's limited yield in rechecking that in the clinical setting.
So that makes me wonder, does having consistently high RF levels mean that your RA might be getting worse?
So if you have a high rheumatoid factor level, if you look at studies of patients with rheumatoid arthritis and they look at a patient's rheumatoid factor and they ask the question, does that predict how this patient's going to do, or does it mark a difference in this patient? And generally, high titers of rheumatoid factor or high levels of rheumatoid factor are prognostic, meaning that higher levels are associated in general with more severe disease. But for an individual patient, I got to tell you, and I see this all the time, it varies tremendously. You can see a patient with really well-controlled, well-managed rheumatoid arthritis who has levels of rheumatoid factor off the chart. And conversely, you can see patients who don't have rheumatoid factor detectable at all, and they're really struggling with their rheumatoid arthritis. So it's not a perfect test, but on average, high levels are associated a bit with more severe disease.
Personally, I am RF negative or seronegative, as we say, but I struggled for a long time, for many years, to find a treatment that worked. So, can you just please explain if someone's RF is negative, does that mean they don't have RA?
Yeah, it absolutely doesn't mean that. And as I mentioned a few moments ago, about 20 or 30% of patients that we see in clinic that we have diagnosed with rheumatoid arthritis are negative for rheumatoid factor. We do often check other autoantibodies. The other one that gets used clinically most often is an antibody that you typically see in your medical record that's termed anti-CCP antibody or a cyclic citronated protein antibody. And those antibodies don't always agree with each other. And we usually term patients seronegative when they're negative for both of those tests. When I see patients who have joint symptoms and findings on examination that are suggestive of rheumatoid arthritis and they're negative for those tests, I really have to ask myself repeatedly over time the question, could I be missing something? And that's what I worry about in seronegative patients. Could this be an alternative diagnosis, such as a viral syndrome or post-viral syndrome? Or could this be lupus? Or could this be an atypical case of gout or pseudo-gout or other conditions that can really trick us and mimic rheumatoid arthritis in the clinic?
That is a really powerful point. Now that we've talked about RF factors' role in diagnosing RA, can we talk a little bit more about how these levels can predict future joint damage or complications?
We kind of touched on that a little bit, but in more detail, if you think about, those patients, I'm just meeting them, we're just diagnosing the rheumatoid arthritis. On average, higher levels are associated with a higher risk for joint damage. And so if you are in that upper echelon of rheumatoid factor concentration, you're at a higher risk if I follow you over time, let's say with serial x-rays of your hands or your feet. Patients with those higher levels are at higher risk for having erosive joint changes or joint damage that we see on the x-ray. And that's been pretty well shown.
Thank you. Testing for rheumatoid factor can help diagnose RA, although it's just one part of a larger picture. So can you share how our understanding of RF has evolved and why this matters for patients?
Yeah, so when you think about RF, it's really interesting, what does it bind in our body? It actually, interestingly, binds to other antibodies. And so it binds to a certain type of antibody called an IgG antibody, which are these mature antibodies that we make in response to infections and in some cases an autoimmune disease. And we think that at these very low, almost subclinical levels, that rheumatoid factor probably plays a cleanup mechanism, that it binds these antibodies and helps remove these extra antibody that we make normally, remove those from our system. That's my kind of simple thinking about that. But in rheumatoid arthritis, these rheumatoid factors have really gone amok and are really binding in excess this antibody. And what it is about the antibody that's made our rheumatoid factor recognize it, that really, I don't think people really understand that very well. But I think in treatment, I think there's been a renewed interest in rheumatoid factor in large part because many of the therapeutics we use are antibodies. And so many patients in rheumatoid arthritis are receiving what we call biologic therapies. And the most common forms of biologic therapies are actually monoclonal antibodies. So antibodies to inflammatory molecules. And at least theoretically, and there's some data to suggest that this is true, people with really high levels of rheumatoid factor, those may actually bind not only our own naturally produced antibodies, but maybe antibodies that we're using therapeutically, that it might bind those antibodies and remove those maybe prematurely from our system and reduce the effect of those. I think there's a lot of research going on in that to really get a better understanding of that.
Wow, I didn't realize that people with very high levels of rheumatoid factor might have a harder time with these treatments. So could that be the reason why some biologics could stop working over time?
I think that's maybe part of an explanation or one of many explanations why biologics fail. And this is a subset of biologics, not all biologics. But again, the most common form of biologic therapy we use are antibodies. And so it maybe has relevance for, many patients.
It's good to know that if one biologic stops working, that there are so many other options out there.
Yeah, absolutely.
So given this new research that's happening on RF levels, can you explain a little bit about why it's important to talk with your doctor about your own RF level and how it might impact your treatment plan?
I think taking a step back, that understanding your lab values and understanding what they mean for you really empowers a patient. It's a better conversation with a patient who understands, why we're checking for labs, how we interpret those labs. I think how we use rheumatoid factor to pick treatment, we're still very early on in that. And really, you would think we wouldn't be since rheumatoid factor was first described in 1940. We have a long ways to go in terms of personalized medicine. How do we best select different therapies? And I think this is, maybe one piece of a very big puzzle.
So we've come a long way, but what can we do now as patients? You mentioned patient empowerment, for example. What lifestyle changes could we make to better control our disease and RF levels?
Well, I think even beyond rheumatoid factors, so let's just talk about rheumatoid arthritis. Absolutely, stressors can impact rheumatoid arthritis. And you as a patient, I'm sure could teach me more than I could teach you about that. I've learned this from patients. Physiologic or even emotional stressors impact the disease course. There's no question about it. Now, whether that operates through rheumatoid factor really is less clear, to be honest with you. I think the lifestyle factor that we probably have the most data for that impacts rheumatoid factor is really cigarette smoking. So cigarette smoking is very closely linked, probably not only to rheumatoid factor, but also to anti-CCP antibody that we talked about earlier. And studies have shown that once people quit smoking, rheumatoid factor levels come down, actually. And so would suggest, and there's been studies to suggest this is true, that when you quit smoking among smokers who have rheumatoid arthritis, that's beneficial for lots of obvious reasons, but it may actually have a beneficial effect on the arthritis itself. And so for all those reasons, and plus all the common sense reasons, counseling patients on smoking cessation is really an important aspect of care that we provide.
Thank you. I'm not a smoker myself, but I do hear that it's a very hard habit to quit, but it's something that we can strive for. I know it's been helpful for me to talk to my doctor about lifestyle changes. In fact, he referred me to a registered dietitian, and I'm working with that dietitian right now. It's actually enlightened me a lot to make lifestyle changes that have helped me to feel better.
Yeah, I think that's great. I think one of the things, going back to what we talked about with laboratory testing and understanding that, it really empowers a patient to be able to take control in a lot of ways with things like dietary modifications. And there are actually professional organizations are all in as well. And so the American College of Rheumatology organization I'm affiliated with has recently come up with guidance around lifestyle factors, the importance of exercise and healthy diets for patients living with rheumatoid arthritis. So I think it's definitely a place the patient really can take the lead.
I love that. Patients can take the lead. Do you think patients can take the lead on monitoring their symptoms? And what are those symptoms that could indicate high RF levels?
I see life through my rheumatology prism, my arthritis prism. And so it's generally, I don't think about symptoms being in isolation with rheumatoid factor. It's really the symptoms of rheumatoid arthritis. And so what we talk to people about, and we meet sometimes because of all the laboratory testing that happens in people these days, we meet people who don't have arthritis symptoms, who we know are autoantibody positive. That actually happens more than it used to. And we talk to people about things like joint swelling, joint stiffness, and stiffness particularly that's after periods of rest, like first thing in the morning, stiffness that lasts for prolonged periods of time, hours at a time. Difficulty using joints, pain in joints, and particularly small joints of the hands and feet seem to be the most common areas for patients early in the disease process. Not always, but most often. And so those are the type of symptoms we talk to people about to be on the watch for.
That's very helpful. So be on the lookout for symptoms. And it sounds like there could be some people who are positive but might not feel the symptoms.
And we know that these autoantibodies, interestingly, show up years really before people get their arthritis. We don't recommend necessarily that people go out and get screened for these autoantibodies because it's just not common enough to make that generally useful. But from studies where we have banked samples on individuals, we know actually that people will develop rheumatoid factor, detectable rheumatoid factor level 5 and even 10 years sometimes before they get joint symptoms. And it really has helped us learn a lot about how this condition occurs in people.
Oh, interesting. So then how can understanding RF levels and working with my doctor improve my quality of life?
Well, again, I think you can speak to this more than I can as a patient, but the more I suspect, if you're like a lot of patients I talk to, the more you understand and the more you are part of the discussion, really, and asking questions and getting answers, you're empowered. And when you're empowered, you can make a difference in your own health trajectory. And that's obviously going to have positive dividends in terms of quality of life.
I like how you put that. When you're empowered, you can make a difference in your own health trajectory. When I go to appointments, I don't go in expecting the doctor to just give me answers. I go in with questions, a bunch of questions, and I know that I need to be prepared. So that's advice that I share with every patient. Speaking of those questions, what should patients ask their doctor if they're confused about their RF results?
Well, I mean, just, what does this mean for me? I think some of the questions you've asked me today are great questions for a patient. So what does this mean for me? Does this mean I have rheumatoid arthritis? Are there other tests that would be helpful here? What does this mean for my treatment, for what I should be doing differently? Are there lifestyle factors that could influence this, or more importantly, influence my course of my arthritis?
Absolutely. Those are great. That is great advice for patients to think about when they're going to speak with their doctor. And if they get confusing results and they don't know what it means, don't be afraid to ask all the questions. Thank you, Dr. Mikuls, for your insights. We certainly hope that the information you shared will resonate with our listeners.
Well, that's great. It's great being here with you today.
Thank you for listening to Let's Get Personal, the podcast where we dive into the real-life experiences of living with rheumatoid arthritis, or RA, and get expert insights to help us better understand our health. This episode was made possible with support from UCB. If you like what you've heard, be sure to rate our podcast, write a positive review, and spread the word by sharing with your family and friends. It will help more people like you find us. And before you go, make sure you take a listen to some of our other great podcasts on the GHLF Podcast Network. You can find all of GHLF's podcasts at ghlf.org/listen.
Be inspired, supported, and empowered. This is the Global Healthy Living Foundation Podcast Network.